Welcome to This Explainer. Today, we're diving into something that literally affects almost everyone at some point, yet crickets. Nobody wants to talk about it. We're talking about anal and bowel health. Let's face it, it's taboo, it's embarrassing, and because of that awkward silence, millions of people suffer needlessly when they really just want to, sit down in peace. So, we're going to break down expert insights directly from Dr. Shigaki. He's a highly specialized proctologist who literally opened his clinic in Okinawa and started sharing this info online because he saw firsthand just how incredibly hard it was for patients to casually consult a doctor about these intimate issues. By the end of this explainer, you are going to know exactly how to decode your symptoms and, more importantly, exactly when it's time to stop trying to fix it yourself and actually see a professional. Here is our roadmap for today. We're going to look at breaking the taboo, the big three conditions, when to seek help, and finally, the specialist's approach. All right, let's jump right into section 1, breaking the taboo. Let's just address the elephant in the room right away. Butt and bowel problems, they are incredibly common. But because of the embarrassment factor, people will literally endure months, sometimes even years, of pain, discomfort, and anxiety before they ever speak up. Dr. Shigaki points out that just getting access to clear information is the very first step to killing that anxiety and empowering you to take action. So before we get into the heavy clinical stuff, I want you to ask yourself a question. We usually measure our bowel health by the calendar, right? Like, oh, I haven't gone in 3 days, I must be constipated. Well, Dr. Shigaki wants us to completely rethink that assumption. As it turns out, the calendar is actually a pretty terrible diagnostic tool for your bowel health. Moving right along to section 2, the big three conditions. So, Dr. Shigaki basically sees 3 main culprits over and over in his clinic: constipation, fecal incontinence, and hemorrhoids. Let's start with constipation. His core point here is an absolute game changer. It is not about the number of days. If you can't pass stool comfortably, you are dealing with constipation, even if you're going every single day. If you're passing hard stools, if you're straining excessively, or if you walk out of the bathroom with this profound, nagging sense of incomplete evacuation, guess what? You're constipated. A healthy bowel movement should be smooth, comfortable, and leave you feeling relieved. If it isn't, something is off. The second major issue in our big 3 is fecal incontinence. This could be something like unexpectedly finding feces on your underwear or feeling a sudden urge and actually leaking on the way to the toilet. Dr. Shigaki makes a really vital point about this. While it's fundamentally not life-threatening, it is profoundly life-altering. It just completely wrecks a person's daily life, their confidence, their freedom to simply go out and enjoy the day. If you are experiencing this, you absolutely have to consult a doctor. Seriously, you don't have to live your life terrified of leaving the house. The third overarching condition is G, which is the Japanese term for hemorrhoids and related anal issues. Now, what's really interesting here is that they actually break down into 3 very distinct types. They aren't all just hemorrhoids, the way we casually use the word. You've got Ibo-G, which is about swelling, Kire-G, which involves tearing, and Ana-G, which is an anal fistula. Knowing the difference between these 3 is absolutely critical for figuring out your next steps. Let's do a quick little self-assessment matrix to help you identify what's going on based on your symptoms. If you've got bleeding and you feel a swelling protruding from the anus, you're likely dealing with Ibo-G. If your main symptoms are bleeding and a sharp pain specifically while you're having a bowel movement, that points straight to Kire-G, a tear. But pay close attention to this last one on the list. If you are dealing with pus leaking, swelling, and a deep, throbbing pain, that is Ana-G. And as we're about to see, accurately spotting that last one is incredibly important for your health. Which leads us right into section 3, when to seek help. Okay, now that we've categorized the issues, when do you actually need to stop playing doctor at home? Well, here is your massive red flag. If you see pus, or your backside is swelling and throbbing, you likely have Ana-G, that anal fistula. Dr. Shigaki stresses that this is a huge warning sign. Why? Because Ana-G literally cannot be cured with over-the-counter medications. It's just going to persist and get worse. If you have these symptoms, you must see a doctor immediately for treatment, which will ultimately require surgery to properly heal. For real, do not wait around on this one. But what about the milder stuff? For things like standard hemorrhoid discomfort or run-of-the-mill constipation, Dr. Shigaki emphasizes a really strict 1-month rule. It is perfectly fine to try over-the-counter treatments at first. However, if you've been using those treatments for 30 days and your symptoms just haven't improved, you need to see a specialist. 1 month is your cutoff. Though, obviously, if you want to be cured faster, early detection is always better, so you can definitely go in sooner. And speaking of treatments, we really need to talk about how we're using those over-the-counter meds, especially for constipation. There is a very real danger in chronically relying on standard stimulant laxatives. Dr. Shigaki points out that people often find a laxative that works once, and then, simply out of fear of getting backed up again, they just keep taking it endlessly without ever stepping back to reassess. The right way to do this is matching the medicine to the actual symptom. For example, using a targeted, non-stimulant magnesium medication specifically to soften hard stools. If you don't know the difference, or if your self-treatment just isn't working, that's exactly why you need a specialist guidance. Finally, let's wrap things up with Section 4, the specialist's approach. Look, not all doctors have the exact same level of training for these highly specific, super sensitive issues. To give you an idea of the level of expertise we are talking about here, let's look at a number. Dr. Shigaki is incredibly uniquely qualified. He holds the Japan Society of Proctology Specialist Instructor Certification, which is a super rare credential, but he also holds the Clinical Proctology Association Skills Certification, which rigorously evaluates actual surgical technique through video submission. He is literally the only doctor in Okinawa holding both of these certifications. That's a huge deal. So where does someone even acquire that level of skill? Well, he honed his craft at the Tokyo Yamate Medical Center. This place essentially laid the foundation for modern proctology surgery in Japan. Think of it as a national hub, the place where the absolute most complex, difficult, and recurrent cases are sent from all over the country. Because he trained at this headquarters, Dr. Shigaki built up a massive toolkit of diagnostic and surgical expertise. And this brings us right to his core medical philosophy. He says the important thing is not just removing the bad disease, but performing surgery that properly preserves the anal function afterward. That really hits the nail on the head. True medical expertise isn't just about the surgery itself, it's about protecting your quality of life. I mean, sure, it's easy enough to just cut out a disease, but the anal region is highly sensitive and functionally critical. A true specialist does the procedure in a way that protects and preserves your function long after you leave the operating table. To wrap up this explainer, I want to leave you with a final thought to chew on. You've seen the symptom matrix, you know the 1-month rule, and you know exactly what the red flags look like. So, what's it going to be? Are you going to keep measuring your health by the calendar and slapping on over-the-counter Band-Aids? Or is it finally time to stop suffering in silence and consult a specialist who can actually protect your daily well-being? Don't let embarrassment rob you of a comfortable life. Take action and take care of yourself.